So today I wanted to give a little background of what kind of job I'm looking at. I'm looking at a job ever since I was little. I had a weird fascination with teeth. I was that weird child that would not want to get the money out of the tooth. I would rather keep the tooth, look at the inside, and see how my teeth formed and how it did that and why it did it that way, and how good my teeth looked when they came out. I was always very self-conscious of my teeth and took pride in when my teeth was always clean, never cavities, everything like that. So today I will be talking about my job field that I am currently studying for is dental hygienist. So in my career path, I did my 4 assessments, and I did take my assessments, and they said 69% was healthcare practitioner and very extroverted, social, investigative, and independent, and achievement and supportive. So some interesting facts about being a dental hygienist. A lot of people get dental hygienist, dentist, and dental assistant very confused since they all work in the same office, and sometimes when you see them walking around, you're like, I don't even know what field is who. I didn't know there was a difference. I thought they all did sort of the same idea. Don't know. So according to factfiles.com, clinical procedures and cleanings are what dental hygienists do. Hygienists do. And they do therapeutic methods. They're the ones that usually walk you into and sit you down at the procedure table, start looking in your mouth and clean your mouth and tell you what's new about it, what needs to be updated in your file, such as that. Dental assistants help and assist the dentist. So when you get major work done, such as crowns, veneers, any kind of root canals, those are dental assistants. So dental hygienists just clean and they can diagnose your issues. They work more hand in hand with the dentist versus right next to the dentist and have to work underneath them. Also, according to the factfiles.com, dental hygienists can perform such as fluoride taking, radiographs, making diagnosis, perform exams, and apply dental sealants, which is the main procedure of any kind of cleanings. In the job growth department, according to studentscholarships.org, the dental hygiene occupation will grow in the next 10 years to 30.1%, which is crazy. Personally, I feel since it is a medical program and it's a little bit easier than, say, nursing or being in a hospital all the time and having 9 to 5 hours, a lot of people are wanting to go towards something that they can maneuver with everyday life and not have to work weird hours like nurses, which is night shifts, weekends, holidays, all of those kind of things. Types of schools that have dental hygienist programs, according to mathcollege.com, usually what schools have dental hygiene programs is vocational schools, community colleges, four-year colleges, along with state colleges. A tip also for me personally getting into this program, you always want to make whatever school that you have that you're looking at, make sure they're board certified, because there is dental hygiene programs, but they're not board certified. So when you complete the program, you still have to maybe sometimes take additional classes after the fact because they're not board certified. It is a little bit easier to get board certified right after school instead of having to take more classes than expected, and that's a little bit disappointing and upsetting when you're done expecting to be ready for the next step, going to work, and you can't do that. According to BLS.gov, in 2018, the median pay is $72,820 per year, which is $35.97 per hour. So the market in the pay is very high. Just remember that dental hygienists work with the dentist, they don't work underneath. the dentist, which also, according to the factfiles.com, in a lot of schools, which was in mathcollege.com, this is just a side tip also for people that are interested, that if you have a dental assistant degree, you can go and it is a little bit easier to go through the process of being a dental hygienist, because you have achieved some of those classes that are already required to be a dental hygienist. You'll be just getting an AA instead of the certification. So that will be all. And I did forget to state my name, which is Kelsey Thomas, and I hope that this was found a little bit interesting, and thank you so much.